Hi everyone, Alistair here. I do hope this finds you safe and well. I'm sure this very challenging period is placing all sorts of demands on you. We'd like to say a huge thank you to all health professionals, regardless of where you're working, be that in physical, mental, social care, whether you worked with us previously or not. Really a big thank you for everything you're doing to help in this extraordinary situation. One of the things that stands out right now is the need for us to support one another through community at a time when we physically need to be apart. It's quite a paradox, hey? I imagine some of you may be in quarantine or be self-isolating. Others will be at the front line for bearing the brunt of coronavirus and all that it brings. And you may need to blow off steam at the end of a shift or even halfway through a shift, for example. But you can't just get together with a load of colleagues. You can't have lunch together. You can't go down to the pub. You can't go around to a mate's in the evening. So to help out, do our little bit with supporting you through this challenging period, we're shortly going to be putting on some Zoom calls where you can offload, share challenges, frustrations, anything you're feeling vulnerable about, or whatever's of most use to you, sharing strategies for coping with X, Y, Z. There'll be the sort of things where you can join whilst eating a sandwich or preparing your supper. Hey, we've all got lots and lots of new extra demands placed on us through this challenging period, and we've just got to be pragmatic about it, haven't we? What would be hugely helpful for us is to know what sort of times would work best for you. Speaking to some of your colleagues, they're suggesting either a lunchtime call and or an early evening call. So if you could post a comment, if you'd like to join us for any of those calls, just post a comment below to say what sort of time would suit you best. Then we'll try and work something out and have something up and running. But this is the sort of thing that's pretty informal. If you need to just connect for 5 minutes, there'll be the opportunity to do that. If you want to have a deeper dive conversation for 15-20 minutes, there'll be the opportunity to do that. We'll keep them as pragmatically focused as we possibly can. I've been working at home now for the past 3 weeks, and the last 2 weeks of which my son's been at home. School's been closed here for a couple of weeks, so homeschooling. My wife's been over in Japan looking after her mum, who sadly is very, very sick. And so if you want some strategies of how to be a single parent whilst balancing work with homeschooling and walking the dog and all of those good things, we've got a couple of weeks experience under my belt. And I've got to tell you, it's tough. There's no perfect solutions. And sometimes we just have to say, you know what, 5 out of 10 is good enough here. We've just got to get through this and not beat ourselves up too much about it. But I think one of the really essential things for us all to recognize is that at our core, innately, we are resilient. And when we allow that resilience to come forth, we do find solutions. We do find ways forward. We are able to cope. So keep that in mind, and I really look forward to being able to speak with whoever has the opportunity to join us at some point in the very near future. Take care, everyone. Stay safe, and once again, a huge thank you to you all. Bye for now.